So the E2112 study was a randomized phase 3 registration trial in patients with advanced breast cancer, the hormone receptor-positive subtype, and patients who had previously been treated with a non-steroidal aromatase inhibitor. And the rationale for the study was that there was good preclinical data in letrozole-resistant mouse models, which suggested that the addition of a HDAC inhibitor, Entinostat, to endocrine therapy was able to overcome that endocrine resistance as it was developing. And that preclinical work had prompted a phase 2 study, the Encore 301 study, which was a smaller phase 2 randomized trial in patients with hormone receptor-positive breast cancer, randomizing those patients to exemestane with placebo versus exemestane with entinostat. And an exploratory endpoint from that study surprisingly indicated an 8-month overall survival advantage with that combination. And that actually led the FDA to give breakthrough therapy designation to the combination a number of years ago. And so the phase 3 trial was trying to replicate those findings ideally and studied a very similar population. So the primary endpoint for the phase 3 study that I presented today was co-primary endpoints of progression-free survival and overall survival. And we presented the final results today, the final OS analysis, as well as the final PFS analysis. And the results did not indicate a benefit of the investigational arm over the standard endocrine therapy backbone for either progression-free survival or overall survival. And I think one of our conclusions was that the median progression-free survival in that setting, this endocrine-resistant population receiving an aromatase inhibitor, a steroidal aromatase inhibitor, that the median PFS is quite short. And the overall response rate to that treatment was also quite low. Notably, the toxicity was not very significant in the study. Grade 3-4 toxicities were not very high, but did include neutropenia, hypophosphatemia, nausea, fatigue. And so overall, the combination was well tolerated. And we are looking forward to exploring a lot of patient-reported outcome data that we have collected as part of this large study, so we can learn more about how patients, I suppose, are doing with endocrine therapy in this setting.